Body fat composition. What I really like that you said before, and most people don't use it, the ratio of 3-to-1 muscle to fat. So how are you able to test for this? How are you able to assess this? And then what does it mean?
In a perfect world, if we were really assessing this, we'd use DEXA, which you and I both know is the most sensitive, is what Peter Attia talks about and uses. We use something called an InBody, which is obviously bioimpedance analysis.
Right.
On the InBody, relative to gender and age, we get a lot of data, right? We get extracellular water, total body water. We get obviously BMI. We get body composition in terms of muscle mass in pounds, body fat mass in pounds, distribution of that muscle and fat into 5 different compartments. But it's a simple calculation. 14-year-old kid, wrestler. He had 5-to-1 ratio of muscle. He had 74 pounds of muscle. He had about, I think, 14.5 pounds of body fat. That's an athlete who's, he was 10% body fat. Or sometimes 60-year-old women who are 240 pounds, and they have over 100 pounds of fat on their body, and they have maybe 50 pounds of muscle. So now they're not even 1-to-1 ratio. Visceral fat is the worst place to carry fat because fat is pro-inflammatory, it produces cytokines, it works its way into our organs. I never saw fatty liver disease. Hardly ever was it mentioned when I first got into practice, maybe in alcoholics, but how many times now are we seeing elevated liver enzymes because of fatty accumulation in the liver in these organs?
Well, the whole idea of adding the functional investigative component is to look past the tree, make the tree move, if you will, look into the roots and kind of determine what the problem is. It's not really root cause resolution anymore, it's root causes resolution. Now, DEXA and InBody, they're very close statistically for body composition. The advantage that the DEXA has is that it tells you about bone. But the InBody I use as well, and the InBody does break up the quadrants, breaks up the muscle to fat. And again, that visceral fat is a critical element because visceral fat, like you said, innervates organs.